Welcome to Truth Lens, where we explore the policies, benefits, and programs that affect seniors and fixed income Americans in real practical terms. This channel is dedicated to providing clarity on Social Security, SSI, SSDI, Medicare, VA benefits, and other federal programs. Many older Americans are struggling just to make ends meet, facing rising living costs that outpace the increases in their benefits. Here we break down complex information into digestible insights, helping seniors understand the real-world impact of these policy shifts and how it affects their daily lives. Our mission is to shine a light on the financial realities seniors face and ensure that everyone who relies on government support knows what's really happening with their money. The Social Security Administration announced a 2.8% cost of living adjustment for 2026, a figure that initially appears promising. For someone receiving the average monthly Social Security benefit of around $1,980, this would translate into roughly $53 more each month. However, this apparent increase is quickly diminished by rising Medicare Part B premiums, which are set to increase by nearly 10% next year. The standard monthly premium will climb from $185 to $203.90, marking the first time it will exceed $200. This sharp rise in healthcare costs eats directly into the Social Security increase, leaving the net gain much smaller than advertised. For the average retiree, the actual increase in available income after the premium deduction will be closer to $34 per month, far from the 2.8% headline figure. For lower income seniors receiving Social Security benefits around $1,000 per month, the situation is even more challenging. After deducting the higher Medicare premium, the effective increase could be as low as 1%. With grocery prices, housing costs, utilities, and prescription drug expenses continuing to climb, this tiny adjustment barely makes a dent in monthly budgets. Over the past decade, Medicare Part B premiums have surged by 66%, while Social Security cost of living adjustments have only totaled approximately 25 to 30% over the same period. This growing gap highlights a systemic issue. Seniors are paying more for health care while the increases in their income struggle to keep pace with inflation and essential expenses. The impact of this imbalance is not uniform, affecting some seniors far more than others. Retirees on Social Security see their benefits rise by the announced COLA, but the higher Medicare premiums reduce the actual increase. Seniors on lower fixed incomes, Social Security disability recipients, SSI beneficiaries, and surviving spouses are among those who feel the pinch most acutely. Veterans receiving Social Security and VA benefits face a similar scenario. Even as their VA compensation rises with the COLA, higher Medicare premiums reduce the net financial benefit, leaving those already vulnerable with less disposable income than expected. In high-cost areas or for seniors managing multiple medical expenses, these reductions can create significant financial strain. To put this into perspective, let's break down the numbers. The average Social Security retiree receiving $1,980 per month sees a $53 increase with the 2.8% COLA. SSI recipients will see their maximum federal benefit rise to $967 for individuals and $1,450 for couples. Meanwhile, the Medicare Part B premium climbs by $18.90 per month, or about $227 per year. After subtracting this premium, the net monthly gain for the average Social Security recipient is roughly $34, equating to an effective 1.9% increase. The Medicare Part B deductible is also increasing in 2026 from $257 to $271, meaning seniors must pay the first $271 of covered services out of pocket. Earnings limits for those still working are adjusted as well, allowing individuals under full retirement age to earn up to $23,880 per year before Social Security starts reducing benefits, and up to $63,600 for those reaching full retirement age in 2026. Rising healthcare costs are a major driver of this financial squeeze. National healthcare spending rose by 8% in 2024, and Medicare Advantage plans, now covering nearly half of all Medicare enrollees, contribute significantly to higher overall costs. Medicare spends about $80 billion more on Medicare Advantage enrollees than traditional Medicare. This disparity, combined with steadily increasing premiums, is creating a widening gap between Social Security increases and actual living costs. For seniors, this means reduced purchasing power year after year, making it increasingly difficult to cover essentials without making tough compromises. The human impact of this financial pressure is significant. Seniors in the United States are facing impossible choices, skipping medications to afford food, keeping their homes at uncomfortable temperatures in winter to save on utility bills, or postponing necessary medical care because copays have become unaffordable. Many of these individuals worked their entire lives, contributed to Social Security, and relied on government programs to ensure stability in retirement. Yet, statistics reveal that 40% of eligible seniors are not enrolled in programs that could help them, often due to lack of awareness or overly complex application processes. The result is widespread financial vulnerability among older Americans, even those who have followed all the rules and planned carefully for retirement. Long-term concerns about Social Security's solvency add to this uncertainty. Without congressional action, the trust funds are projected to be depleted by the early 2030s. If no adjustments are made, benefits could be reduced to approximately 79% of scheduled amounts, a devastating scenario for seniors who are already struggling to make ends meet. Even with current protections, the incremental rise in living costs, combined with faster growing healthcare expenses, threatens to erode financial security for millions of Americans relying on Social Security, SSI, SSDI, and VA benefits. This situation emphasizes the importance of understanding the full picture behind the Social Security COLA and Medicare increases. While the COLA provides some relief, it is often insufficient to keep pace with healthcare and daily living expenses. Effective financial support requires awareness of how these adjustments interact with Medicare premiums, prescription drug costs, and other mandatory deductions. Seniors on limited incomes feel the gap more acutely, as smaller raises in benefits do not adequately compensate for rising costs, leaving households with less discretionary income and fewer options for financial flexibility. The trajectory over the past decade demonstrates the growing imbalance. Medicare premiums continue to rise faster than Social Security increases, compounding challenges for seniors each year. Prescription drugs, supplemental insurance deductibles, and co-pays continue to climb, placing additional strain on fixed-income households. For many, the financial reality is stark. The amount of money left after mandatory healthcare expenses is shrinking, making it more difficult to maintain quality of life and access essential services. This pattern underscores the importance of awareness, careful planning, and staying informed about benefit changes and deductions. The financial pressures described here do not affect everyone equally, but they are widespread and growing. Seniors, low-income beneficiaries, those living in high-cost areas, and households managing multiple medical expenses are particularly impacted. Surviving spouses, veterans, and individuals on disability benefits also feel the effects of these rising costs, often with limited room to absorb unexpected expenses. The cumulative impact over years can significantly reduce quality of life and increase vulnerability, highlighting the importance of understanding the interplay between Social Security increases and rising Medicare and healthcare costs. As these trends continue, the gap between Social Security adjustments and living costs represents a serious financial concern for American seniors. While the COLA appears positive on the surface, real world increases are substantially smaller once Medicare premiums and other mandatory deductions are accounted for. The implications for daily life are considerable, affecting household budgets, access to medical care, and overall financial security. For millions of seniors, this means that even with a nominal increase in benefits, there may be little to no additional income available for other essential expenses. Ultimately, the data and analysis from recent reporting, including the New York Times, paint a sobering picture for retirees and seniors across the country. Rising healthcare costs, insufficient Social Security adjustments, and the erosion of purchasing power all combine to create a challenging financial environment for older Americans. Understanding the numbers, recognizing the real impact of deductions, and maintaining awareness of policy changes are critical steps in navigating retirement finances. For seniors living on fixed incomes, every dollar counts, and the true effective increase in Social Security benefits matters profoundly.